Dr. Anelle Primm is here now to talk about natural disasters, especially climate change, and how they uniquely impact Black, Indigenous, and other communities of color. Thank you so much for being here.
Thank you, Dina, for having me.
So I want to talk about the focus of this year's conference, and that is strengthening social connectedness, and how that is so interwoven with mental health.
You know, I think it's really important, especially in this time with COVID-19 pandemic, and how many people were saying in order to protect yourself, you need to socially distance. But many of us in the mental health community have advised against using that terminology, and instead we suggest that people physically distance because we need to be socially connected. The social connection piece is really critical to our mental health.
What an important nuance. Physically distance, don't socially distance, because in pandemic, we saw mental health issues rise exponentially. We saw substance use issues. So can you talk about natural disasters and how in the wake of that, we see increased anxiety, PTSD, depression? How might we mitigate those?
I think it's really important after a disaster to maximize mental health by employing 5 main elements. Promoting calm, promoting safety, promoting self-efficacy and collective efficacy, meaning that you can encourage people that they can do things. They can establish some of their normal routine even in the midst of a disaster. And then connection is a part. And then finally, hope, letting people know that things can and will get better.
There are so many elements to this. How do we really facilitate that comprehensive response after a natural disaster like this?
Well, I think it's so important for the local and state level to be involved. The emergency management agencies and departments of mental health and behavioral health for the states and localities. Of course, FEMA is very important. I think we need to be very proactive in letting people know in advance. We should not be waiting until a disaster to let people know about these sorts of supports. And of course, the funding is critical.
And that gets back to your key focus, and that is connectedness. Is there anything that is perhaps the most important to start and begin to get that sense of connectedness back after a natural disaster?
You know, I think one part of it is making sure our communities are not forgotten, raising that awareness, and also ensuring that disaster professionals are diversified. At this point, they really are not. They're very much in the minority, and we know that those disparities are connected to the dearth of disaster professionals.
Such an important topic, so many tentacles. Thank you for all you do, Dr. Anelle Primm.
Thank you.